for being here. And I'd like to invite Dr. J.D. Filippone, our Chief of Cardiology at St. Peter's Hospital, to come up and say a few words.
Hi everybody, I'm going to keep this brief. I want to thank you everyone for coming today as we highlight some of the remarkable achievements of the cardiovascular team here at St. Peter's. As Chief of Cardiology, it brings me great pride and excitement to be able to share with you some of these stories that as physicians and clinicians we see every day, but to be able to share this with the community is really exciting. The cardiovascular team here at St. Peter's has a long history of excellence in this, clinical excellence in this community. We're consistently ranked as the top hospital in the region in terms of patient experience and clinical outcomes. What you're going to hear about today is some incredibly complicated cardiac patients who are incredibly ill and their recovery. And we're going to consistently be using the theme of team here and multidisciplinary approach, which is really the hallmark of the cardiac team here and their ability to take care of these incredibly ill patients. And it's the team that's able to seamlessly integrate with one another from cardiology, cardiac surgery, vascular surgery, radiology, nursing, all the way on to cardiac rehab. And it's that collaboration that allows us to accomplish these difficult procedures. And I can't say enough about the nursing team, because as great as Dr. Hurst and our physicians in the cath lab are, the nurses are really the ones who do the heavy lifting here. So it's this team approach that allows us to sort of complete this comprehensive and personalized care for these patients. In addition to the clinical excellence, though, the team is very focused on a patient-centered approach, and each patient is unique and their experience is unique. They each have their own fears and hopes, and the team's able to focus on that and keep that in the forefront and help guide patients and their families through this difficult journey to recovery. So, through our collective efforts, we've witnessed multiple success stories, and you're going to hear about some of them today, and these success stories that have helped return patients to the quality of life that they do. And it's those kind of stories that inspire us to continue to do what we do here every day. So I'm happy that everyone could be here to take part in this. So without further ado, I'll turn it over to you, Colin.
Great. Thank you, Dr. Filippone. Thank you, Dr. Delfino. And welcome, Maria, Barbara. I wanted to end up keeping some of my comments about the clinical probably pretty brief, because I would like to end up having an opportunity really to focus on how we have been able to make this possible. To echo some of the words that Dr. Filippone had used during his introductory remarks, is that really this is a team-centered approach, and that as a member of the team, I really want to take this moment to highlight some of the other folks that are part of our team. Some of my colleagues that are here from our cardiovascular division, the ICU nursing staff that's here, as well as our esteemed colleagues from the cath lab that are here. Also, folks from the emergency department, as well as our critical care units. Invaluable team members to help make our cardiovascular team really the top in the region, in my opinion. And so, first I'd like to end up sort of pivoting here and talking a little bit about Maria's story. Maria and I ended up having the happenstance meeting in the emergency department after she was here from home in New Jersey with her son. And her son was accompanying her through the region for more or less a ski vacation. He was actually skiing at one of the local mountains. She had a fainting spell in one of the local hotels, and she was here in our hospital. She ended up having 4 or 5 different cardiac arrests in the hospital, and our amazing team in the emergency department, very attentive, was able to end up continuing to support her as we came up with what we thought was the best decision plan for her at this time. She did receive medication to help with one of the reason really why she ended up having this event. She had a very large blood clot that likely originated in her legs, traveled to her lungs, and then obstructed flow from the lungs from her heart to the lungs and then to the rest of her circulatory system. We refer to this as a pulmonary embolism, and receiving medication to try and break up this clot was really helping to sort of stem the tide, but it just wasn't enough at that point. So myself and the rest of the team from the ICU as well as cardiac surgery thought that it would be most appropriate for us to end up trying to remove the clot in the catheterization lab. We did that with one of our innovative devices. It's an aspiration thrombectomy catheter. In plain speak, it's really just a large tube that we end up drawing negative pressure on to remove a lot of this clot. And we're able to really end up getting a very, very helpful response, but still, Maria ended up having some difficulty getting through that procedure, and I could end up telling that the right heart needed a little bit more support. And so with the help of our local Abiomed team, as well as the extremely valuable cath lab members, we were all able to end up taking the time to really study some of the pressure tracings as well as the information gained in the lab, and then thought that the best opportunity for us to get the greatest degree of recovery would be through this device where I'm going to end up showing you. This is a transvalvular microaxillary flow pump that we end up putting up from one of the large veins in the body from the legs, and it ends up into the heart, and it helps to promote blood flow from a sickened right side heart. That sickened right side heart was really because of this large blood clot, and it helps to end up taking over the heart's native contractility in a time where it's too sick to perform on its own. And so I'll end up just showing you guys a little bit about what this heart pump does, and this was what we ended up placing to help support the procedure. And so with the use of a guide wire as well as catheters, we're able to place a large tube into one of the vessels in the leg, and then through that tube we would be able to end up deploying the device, which you'll see here. And again, this is a catheter-based and wire-based procedure. You can see that the wire that's moving there is located in one of the larger veins coming from the leg into the heart, and then we use a specific catheter to get that wire, which will be our railroad track, in order to develop that type of pathway that gets the device to where we need it to be so that it supports the heart in its moment of need. And bear with us here with the animation. Okay, all right. So essentially what we were able to do is use this support device in order to get you through your moment where you most critically needed that help and support. And over the course of the next 48 hours, we were able to end up using adjunctive medical therapy through the IV to help support your heart as we continued to wean down the support from the mechanical device. You know that you can't go home with a mechanical device, but we also want to make sure that you go home with your own heart and not having to provide any restorative therapies or artificial therapies for you. And again, this was really a truly success story. After about 48 hours, we were able to take the breathing tube out, we were able to wake you up, and we were also able to end up making sure that all of your faculties fully intact. When I hear these types of stories about patients like Maria in the emergency department, 47 years of age, mother of 4, and one of our neighbors in the community, I think that really all of us would be in a position where we would offer the kitchen sink. And I think that collectively as a team, we did that. And I'm just so thankful that we were able to get you through that moment, through that probably most challenging moment, and return you back to your family. So, yeah. Please. And so we're going to end up pivoting here. We'll talk a little bit about my next guest, Barbara, and some of the amazing things our team has been able to accomplish. And then I'm going to end up inviting you to give some comments just about your experience. Barbara, you and I ended up having a perchance meeting as well. Between our team, I'll tell you a funny story. I was scheduled to take a flight from Albany to Detroit to spend Christmas on a Friday with my significant other. And it just so happened that the weather, as it is in Detroit, as it is here in Albany, was just terrible, so the flight was canceled. But myself and our team here, specifically Dr. Paval, we were able to end up trying to come up with a plan, about how best to care for Barbara. And the backstory, Barbara, she and her husband from Middleburg, they own a farm, and she had been at Columbia Hospital, one of our referring sister hospitals, had a very unfortunate heart attack that brought her into the hospital, and then ended up really being required to come to St. Peter's for bypass surgery from our heart team, from our cardiothoracic surgeons, as well as a valve replacement. Knowing that her heart muscle was a little bit threatened and going through a big procedure, it was a little bit difficult to get you through that immediate post-operative period. I know you chuckle, but you and I both ended up having a couple of different as well as difficult moments together. But I thought that giving her the really the benefit of our support teams to give her the innovative technologies that we offer here was probably in the best interest. And both of your ventricles of your heart were very, very sick. And so coupling these two devices, the one that I just showed, as well as the one that you'll see in the next video here, is going to end up being extremely important for full recovery. The second device that we used was the Impella CP, another transvalvular microaxillary flow device that we use on the left side. So you had not only a right-sided heart support device, but a left-sided heart support device. And over the course of 72 hours, with the cath lab staff, one of my interventional colleagues in the back, Dr. Ricario, as well as the cardiothoracic surgical staff, able to get you through some of those difficult 72 hours after we ended up with that remarkable surgery. And I'm just so happy that we ended up able to see each other now as outpatients, right? And to get you back to you and your husband on the farm. So I'll take a moment here, and hopefully I can end up showing the next video here. And this is the Impella CP that I referenced. This is the left-sided device that we used. And again, this has the indication for helping patients both undergoing percutaneous coronary intervention procedures with stents to help open up either narrowed or blocked arteries, or patients like Barbara and Maria that their blood pressure was so low and heart so weak that the assistance of a mechanical device was helpful. The device works by taking blood, aspirating it from the left ventricle and putting it into the aorta to provide full circulatory support in an antegrade fashion. It's a catheter mounted base device, and it also integrates along with a console that's going to be outside of the sterile field and at the bedside. And again, I think that if we end up having a conversation with all the support staff, everyone's familiarity with this device in the hospital is pretty well known. And so again, this is the type of device that we use for some of the most critically ill patients here in our hospital. And Barbara, with the help of the Impella RP as well as the CP, I'm so glad that we were able to end up getting you through that moment, and both of you really to end up having the opportunity to see each other as outpatients rather than inpatients. So I think that here, I'm going to end up pausing here. And Maria, I would really love for you to end up coming to share your side of the story to get a patient perspective.
It's a pleasure to be here today. When I was asked would I be able to come today, I said absolutely. I actually came home early from Dubai from a business trip to be able to be here today. That's how much it means to me to be here and recognize this hospital and the team for what they have done for me and my family. As you can see, I have 4 young children ranging in ages now 19 to 10. At that time, they were 18 to 9-year-old. and as Dr. Hurst said, Mark, who is sitting next to my husband, and I came to Albany. We left very early morning at 5:15 in the morning because Mark is teaching skiing in the capital region. This is his second year. So we came here at about 7:45 for his to start his lessons. And I was very tired. So when I dropped him off, I was like, Mark, why don't you go ahead, do your lessons? I'll stay in the car and just take a nap. I had COVID more than 2 weeks ago, before that Saturday on January 7th. And you know, Michael and I, my little one, youngest son, we were very tired. We had fever for a couple of days, right? But we got better. Everybody else in the family got sick with COVID as well. But by the time Christmas and New Year's rolled over, we were all doing better. It wasn't until I went back to work on January 2nd that I noticed that, oh, maybe I'm not 100% yet. On January 3rd, I had a full day of meetings and went to lunch to cafeteria, which is literally just a 5-minute walk from my office. And when I came back, I was completely out of breath. And I was more annoyed, honestly, than concerned. I was like, I can't believe, I can't even go to lunch and come back. Like, what is this? It's more than 2 weeks ago that I had COVID, I should be fine. But I was nevertheless talking to my administrative assistant and I said, we'll most likely have to clear my calendar Friday. I need to go see a physician because I need to figure out what this is. This is just not right. And as we were talking about that, a colleague of mine came by and said, I have a wonderful physician. My mother just moved here. We did all the research. I was like, great. I didn't have a primary care physician. I was never really sick more than having a cold. And I was like, wonderful. I called them Friday morning. Unfortunately, they weren't taking any patients. And they were, after this, I described the symptoms. I'm short of breath. I had COVID 2 weeks ago. They did offer emergency room or emergency care, and I was like, no, I'm not that sick. I'm doing much better than what I was doing 2 weeks ago. It's really not an issue. So Mark and I came up on Saturday, and as Dr. First said, the day was okay. But when I came to the hotel, thank goodness, and I started walking towards the lobby, I fainted for the first time. Mark ran in to get help. The receptionist came out and offered to call an ambulance. I said, no, it's not needed. I'm just tired. I just need to get to my hotel room and lie down. I'll be okay. So we started walking to the lobby again and I fainted again. Now mind you, Mark is 16 at the time and he's watching all of this. They didn't give me an option at that point. They called an ambulance. So the ambulance came and they took me into the ambulance, and at that point I knew there was something wrong because I just couldn't get enough air in me. It's really difficult to describe, but you feel like you need to take another breath, and it just was just never enough air. They put an oxygen mask on me, which just made me honestly feel like I was going to suffocate. I couldn't find the vein. I was insisting for Mark to go with us. He's a minor. So Mark sat in the ambulance. And at some point, somebody said, we'll take her to St. Peter. Now, we are Catholic, and St. Peter means a lot to us in our religion. And as soon as I heard it was going to St. Peter, I know many of you may not be able to relate to this. I was like, oh, I was gonna be okay. And I relaxed a little bit. And then I had just one other lucid memory, and that was giving my phone to Mark and saying, call Dad, and just tell him what happened. From that point on, the next thing I remembered was a young woman trying to stop my bleeding. And to this day, to tell you the truth, I'm not sure if that's a real memory or not. And then the next memory, which I do know is real, is Dr. Colin coming in with a mask, fully robed, in hospital gloves, taking my left hand and saying, oh, I'm so happy to see you're doing better. You had a skid for some time. And I don't know, did I make a facial expression or did I say something, but I thought, oh my gosh, like what is he talking about? My head was hurting, my chest was hurting, I had all kinds of tubes coming out of me, and he was so happy to see me do better. And I don't know if they say something or did I just make a facial expression, but you then proceeded to say, I don't think you realize how sick you were. And I was like, no, I'm not sure I really do, you know. And you left at that time, and then when I was moved to the cardiac unit, then I actually have more consistent memory of what was happening. And one of my first memories was, and I don't see him here, it was a gentleman with reddish beard, with reddish hair, coming to my room after I pressed the button because I was bleeding from my incision, one on the right leg. He was in his brown jacket, and he came in and he provided pressure for the wound in his jacket, literally, you know. Somebody else came into the room, offered to take over. It seemed that Luke, that's when I learned his name, was on his way home from work. He finished his shift, that's why he was dressed to go home. Yet nevertheless, he stopped by in our room and helped stop my bleeding. I was like, oh, this is, you know, a really special place. And then I talked with Jenna, and I asked her, she was my nurse in cardiac unit, and asked her, could she please explain to me how exactly I ended up here and why am I so sick? So she literally went through the notes and told me, you know, what has happened in the ER. And my heart seemed to have stopped 5 times in the ER, and they had to revive me 5 times. With Dr. Thompson's help, with Dr. Hurst's help, there were other physicians involved that I have never seen, or maybe I've seen and I don't recollect at all. I just know them by names in my notes. So really, I mean, what can I say? I can say I had this episode on January 7th. On January 13th, I was discharged from the hospital. And on January 16th, we made cakes to celebrate my daughter's and my youngest son's birthdays. They turned 10 and 12 on January 20th and 30th. So basically within 10 days of having this massive complication of 5 heart arrests, I was back at work baking cakes for my kids and just celebrating their birthdays. And none of that would have been possible had it not been, number one, for the skill of the physicians and the team that has taken care of me. Somebody had to know how to do the CPR properly to bring me back to life, to take the clot out, insert this impella. So just the level of skill clearly is extremely high. Number 2 is the foresight and courage, right? For Dr. Thompson to realize on a CT it's a blood clot and that I needed high doses of heparin or whatever, you know, the medication was, I'll call it the heparin. For your courage to actually use this new device, right? Persistence in, like, imagine having a patient who codes once and then again and again. I mean, how many times do you try? Do you know? But they kept going and they kept trying to keep me alive until I stabilized a little bit, I suppose. And then the last one is compassion. It really is these little acts of kindness. Like Luke didn't have to stop by in his clothes on his way out, you know, while he was passing my room and saw the light come on. Dr. Wind, he didn't necessarily have to sit down with Mark and explain to him what was going on with his mom when he was in the emergency room waiting to see what my outcome will be. My husband told me the nurses always picked up the phone and gave him an update when he wanted. So just the entire team, it's hard to describe. It just felt like they really cared. And I know that you're medical professionals, so there is a physical aspect of taking care of patients, but there is also the emotional part of it. You know, when you're a patient, you do not know, how did you end up here? What does this mean? Like, will I be able to go home? Will I be able to see my kids? I didn't say goodbye to them. I had no reason to say goodbye to them. I didn't tell them I loved them. I left at 5 o'clock that morning. I haven't even seen them. They were sleeping, you know, when we left. So when you're going through all of these emotions, it's just really important that you have not just the physical needs taken care of, but that there's also somebody there who listens and cares. So I just want to thank all of you. Dr. Hurst said it's more than, as much as I love you, Dr. Hurst, it's just more than one physician. It was really a team, and I really thank you all. For those of you that I do remember during my lucid times, and those of you that I don't remember, but you were taking care of me, I really thank you from the bottom of my heart, and I think I can speak for my family as well. They feel equally that way. Is that true? That's true. Okay. Thank you all.
Maria, thank you so much for sharing the patient perspective with all of us, what that was like for you, how scary that was, the not knowing, and the compassion of our team. And Barbara, thank you as well for being here with us. Your stories inspire us all. They remind us that the human spirit is capable of remarkable feats. May this reunion be a source of inspiration and a reminder that you are never alone on your healthcare journey. And to our healthcare professionals, we offer our deepest thanks for all that you do. You are the heart and soul of our hospital. Your unwavering commitment, your expertise, and your genuine compassion have brought us to this moment of grateful hearts. So thank you. And I'd like to open the floor now to any questions that any of you may have for either our physicians, our care team, or our amazing patients. All right. Well, as we conclude, I'd like to direct you to the table to my left, where Brian will be doing a demonstration of the Impella device, should anybody wish to learn about it. And on the right, we have lunch, so please help yourself, and thank you again for being here. Have a great day.